Alright, so you got plantar fasciitis and you do not know what to do. Tired of the shots, tired of the heel, the boot. Things not working for you. Well, let's explain what plantar fasciitis is. It's irritation on the covering of the muscles that are on the bottom of your foot. So the pain is going to be felt where you see that arrow, and the fascia is a covering of the muscle. So what we need to do now is tell you which muscles are involved, which ones are going after. First of all, we're going to go after the Tibialis posterior, Tibialis anterior. We're going to go after the Extensor Digitorum. We're going to go after the gastroc, the flexor digitorum, and the Soleus. These muscles are commonly involved and often overlooked when treating plantar fasciitis. So these exercises will help you identify where your plantar fasciitis is coming from. Let's start with, first of all, tibialis posterior, and this is involved for inversion. That's the action that we're looking at here. Is we're lifting the towel, pulling it towards the midline. We're repeating this. If you feel tenderness, go up and down. You'll feel where that muscle's involved. You feel restriction or tenderness, you'll know where to look. All right? Now, you can repeat this all day long, but I want you to dig into the muscle afterwards. Next, we're going to be looking at the tibialis anterior, which is a big muscle, again, involved with inversion. Okay, it's inversion and dorsiflexion. So these are the two actions you see us doing here. Okay, we're pulling away, now you're pushing towards, pulling to and pushing away at the same time. All right, extensor digitorum. This is for eversion. So you're going to try to stand. You can get a towel if you don't have this particular foam pad. Stand on it, curl the toe under, and stretch. Put some weight into it. If you feel a tension, you have a better idea that this muscle group is involved. Okay, it doesn't happen that often, but you'll find it, and then we can treat it a lot easier. Next, we move on to the Gastrocnemius. There's two heads, medial and lateral, bilateral, so they're on both sides. And what's happening here is you're going to point the toes together, and you slowly lift up. And hold it towards the end of the stretch. When you're done, start digging the outside of your calf and the inside of your calf. It's very important you do this to find out where those tender spots are. Next, we're going after the flexor digitorum, and this is involved with inversion, okay? And what you're doing here is you have a little bit of a tug of war with the foot, and you're pushing the toes down against resistance. You will feel it if it's involved. If it's tight, go in, palpate, dig around, see if the muscles are involved. Next, we're going to move on to the soleus. This is the soleus we're testing here is going to be the one towards the back. You bend forward, you hold it with the foot firmly on the floor in rear of the front foot, okay? So the leg closest to us, you're going to dig down. Dr. Brian McKay, Core Health in Darien. We have helped a lot of people with plantar fasciitis. Will you be next? All you have to do is click to schedule now, and you'll be taken to a page where you can schedule an appointment. I urge you to do so. I would love to help.